I am Dr. Tamer Seckin. We are at Sao Paulo, Brazil, the Brazilian Endometriosis Society's first annual meeting with ISG and their first global meeting on the subject, right? I am with Sergio Podarich, who won the first prize about his molecular immunology research. This was last year, or this?
Last year we won the prize at the World Endometriosis Congress
Award.
It
is so important when we look for excellence in endometriosis care, as far as from patient angle. We look at not only surgery, their diet, their pain specialist, their natural remedies, the general surgeons being involved, the urologists being involved. But from a research angle, the perfection never ends. Yeah. We need to have our immunologists, right? Researchers, geneticists, and what am I missing?
There are some pathological findings.
Pathological, yes.
Yes, and there are lots of.
Okay, so the bottom line is perfection in endometriosis is we are aspiring for. This is one area that also you're bringing to the table. I really want to talk about your research. What was it about?
Yeah,
and what else is in the horizon from this research coming?
My research was something about immunology and endometriosis. We studied how the cells are involved. Immunological cells are involved in the pathogenesis of endometriosis. There are two types of immune responses in our immune system, and we studied in endometriosis which one is the main.
Okay, one is antibodies.
Yes.
The other is cells.
Yes.
And tell us, what did you find?
Antibodies, when there are antibodies involved, this is called Th2 response, and when there's a predominance of cells, this is Th1 response. So it's Th1 against Th2 response. Th is because of lymphocytes T helper.
Okay.
So it's Th. So we studied Th1 and Th2 responses, and we saw that in endometriosis there are both responses.
So in other words, when obviously there's menstrual effluence,
yes.
The menstrual implantation, it creates a unwanted tissue there, and it calls for help.
Yes.
It comes from peritoneum, these T cells, or from the peritoneum lining. From both angles, the attack starts.
This is the next step. We just studied the peritoneal fluid, and we saw that there are some cytokines, there are some substances, inflammatory substances that try to eliminate the cells. The cells should not be there, and the immune response tried to eliminate it. And we saw that the cell cytokines, the Th1 response, is present, but in some cases there are also antibodies. So the
first chemotaxis response to endometriosis comes from its contact with the peritoneal fluid, before it sits down on the mesothelium. The first fight starts there. If the insult is so great, the contact of peritoneum and the clot is right away. Obviously, your immune response will come from the peritoneal layer, mesothelial layer, and then probably this whole quagmire, big questions about the epithelial, mesothelial transformation, the stem cells, and the whole immunological fight, angiogenesis. I think this is the next step that you guys are going.
The next step is we're going to study the cell, not just the peritoneal fluid. We're going to study the cell and to see if the cytokines are expressed by the cells, if the protein is expressed in the cells. So not just the environment, but the
In your study, how many cases did you look into?
Oh, we studied 100 cases, and now we are planning to study another 100, but different patients.
Will there be any different technology or techniques used when you are going to be doing peritoneal studies? In a humoral way, the fluid is different than the tissue. Tell us what these are.
Because when we study the peritoneal fluid, we can measure the cytokines like cholesterol or any test. We test the cytokines on the peritoneal fluid. But inside the cell, we have to do another kind of test. It's called RT-PCR. It's a special test to see the genes and to amplificate, to overexpress these genes to see if they are doing this specific protein, cytokines, anything that we want. It's different from the peritoneal fluid. It's a specific test.
I am a surgeon. I'm an endoscopic surgeon.
I'm a surgeon too.
But then you have other qualities of being PhD or whatever you're doing with the. I may ask very simple questions. In my mind, the real question is, to what portion do you think of the endometrial debris the body, the immunological response directs to the glandular elements or the stroma? Because that in my mind, as a surgeon, I consider the glands are my friends. The stroma is my enemy, because stroma is the one that's the evil force, because glands you see.
Yes.
The fibrosis is the problem. It's always the reason for incomplete surgery and not seeing everything.
We will try to answer this question separating the glands and the stroma. We also think that the stroma is the enemy, but we will separate it with electronic microdissection. It's a special kind of dissection that permits, that allows separate glands and stroma. So we'll try to find this kind of immune response inside the gland, the cell, and inside the stroma. So maybe the stroma, we are right, the stroma is the enemy, but still we don't know it.
Are there any sophisticated or recent immunological dyeing techniques that could be unique for our mesenchymal study, or to expose the endometriosis or stromal elements, or even adhesion formations that are unique to endometriosis?
Yeah, there are lots of substances like cadherines and matrix metalloproteinases that are substances related to adhesion, and there are no immunohistochemical antibodies to study this. So we have to use this kind of test that I told you. It's the PCR, the polymerase chain reaction.
Yes, PCR.
Yeah. So this is what we've got now.
Thank you, Sergio. It's a pleasure and honor.
Okay, thank you.